like to bring you into this conversation because your expertise is the brain, and we've just heard so much about the frontal cortex versus the limbic system. Why is it so difficult to address trauma, and how do you focus your therapy on that emotional limbic center of the brain?
Yeah, so I want to give an example that I always give my patients. Imagine, for all of us here, if you're watching, imagine an event, maybe your first kiss, something that was really positively charged. Can you remember where you were, maybe who that person was? And now something really awful like 9/11. Can you remember that? And you can see how the brain attaches sort of very visceral visual memories to positively and negatively charged emotion. Now, can you remember what you were wearing or where you were 2 breakfasts ago, or what you were having for lunch? So the brain is always, there's so much information that it always has to decide what it's gonna store. And it's gonna store not so much in words on the left side of the brain, but in the limbic system and on, sort of the right side of the brain, when we think about images and we think about these sense memories. So then we have this other part of the brain that's sort of the smoke detector, and if it's stored those images as dangerous, then you have a smoke detector that's not gonna go off when your house is on fire. It's gonna go off every time you put a piece of bread in the toaster, right? Because it's always gonna think you're in danger. And then all those memories that are very visceral, that feel, that you sense, that you taste, you're nodding your head, you know exactly what I'm talking about, right? They're gonna come back. So, we have these therapies now that are, I'm so glad that you're doing the work that you're doing, what we call bilateral stimulation. And at first, the first time somebody who's never experienced this, they're like, wait, what do you do again? So it is sort of, in a way, it's like a cognitive behavioral therapy. It's sort of a next generation cognitive behavioral therapy. And imagine in your mind's eye, but not talking about it, but in your mind's eye, while something is hitting or tapping either both sides of your body or stimulating your eyes on left and right side in both ways. There are 3 types of therapy: EMDR, accelerated resolution therapy, and then a protocol I created called subconscious visualization technique. Now, in your mind's eye, while your left and right side of your body is being stimulated, because what part of the brain is this right hand being controlled by? This part of your brain, the left, right? And vice versa. So imagine if both sides of your brain are being stimulated while in your mind's eye, you're going right to that memory. It somehow, in EEG studies, we found that it actually moves the activity out of the part of the brain where that traumatic memory is stored. It sounds like brain magic, but when you look at the data and you look at the published research, it's, wow, it really works.
Absolutely, because like you said, if you're just treating the symptoms, the problem's still there.
That's right.
It's help you become the person you would have been if none of that had ever happened to you. I'm not kidding. It is that profound.
We're so proud that you went and that you followed through. I do want to ask you one thing before we go to break, and that is, what would you say to someone right now who has suffered from abuse, and maybe they're where you were a couple of years ago, and maybe they're afraid to seek help or to try something like this? What would you say to them?
Just do it. Just do it. However old you are, you have tried everything you know, and it hasn't worked. And if you're ready to heal, there's a way to get it done. It is possible to find your hope. It is possible to find love. It is possible to find happiness. And it's possible to go back and be the child you would have been had none of it ever happened. Living proof.
Thank you so much for sharing your story. Jordan, thanks for all the great work you're doing, and Dr. Dow, appreciate your input. The most remarkable thing is this retreat is actually free of charge. You can find out more information at uniquefoundation.org. We're going to have more information about all this on our website, also information on how to report trauma, physical abuse, how to heal. Head to thedoctorstv.com.